So for our ERCP, our patient is going to be prone, so we'll put our marker prone onto our C-arm. Take the picture, and then we're going to flip upright the R, and then just make it nice and straight.
So similar to the cholangiogram, we're going to be looking at some of the same anatomy. So again, we have our liver right back here, and right underneath the liver we have our gallbladder. Right here we have our stomach, and then you have your duodenum, which is that first curve of the small intestine. And then we have our common bile duct right here that goes all the way up and branches off into the cystic duct and then the hepatic ducts. So what the doctor is going to be doing is sliding the scope down your throat into the stomach. He's going to get all the way into the duodenum. He'll find the ampulla, and then from here is where he'll use the x-rays. He'll stick a wire into the ampulla, into the common bile duct all the way up, and then he'll put a little catheter over that wire that has a little tiny balloon at the end. And once he gets that catheter and that balloon all the way up into the hepatic ducts, he'll inflate that balloon, and then he'll pull that balloon all the way down to bring out all of these stones from the common bile duct back into the duodenum. And that just clears out the common bile duct from any bile stones.
So this is what we're looking for in the x-ray for the ERCP. You have that scope coming down and curving into that duodenum. And then right here you can see a little catheter and a wire coming up the common bile duct. Right here is where the cystic duct is, and that wire keeps on going up into the hepatic ducts. And again, you'll inflate that balloon up here at the top and pull that balloon all the way down the common bile duct to try to get those stones out. That's not the only reason for ERCPs. A lot of times they'll also dilate the duct with a balloon to try to open up a stenosis. Sometimes they'll also put a drain just to help drain all the fluid from the bile duct. So there's a lot of other reasons why they do this procedure. But for the most part, what I have noticed is that they use that balloon, again, just to try to pull those stones out of that common bile duct.
So since we're still dealing with the right side of the patient, and the patient's prone, we're gonna center a little bit towards the right side of the patient, and I like to center about 3 to 4 inches above the iliac crest. From there, you just want to make sure that the tip of the scope is at 6 o'clock on the screen, and then you'll just be taking spots and live fluoro from the doctor.